I would watch the governor on TV, and he seemed like a really compassionate, sincere man. And being a Democrat, I was very hopeful that he would read my letter. So I was just hoping and praying that somebody would listen.
Mrs. Johnson wrote me last October about the pain that her family was suffering. Listen to what she said. And I quote in part, "We are literally going bankrupt, trying to meet our regular household expenses and pay this high premium.
This is truly making me sick. I feel I am throwing hard-earned money away to health care companies
That is getting rich on millions like myself that need money to have a home,
savings account and a little money to set aside to educate their children. Not only does this financial burden take every last cent we have, it also puts a tremendous stress on our marriage and family life. I have actually considered a legal separation
just to put myself and my children on a welfare medical card."
There were so many mothers in particular who were afraid to let their kids play sports, or afraid to let their kids just play like any other kid because what might happen to them.
A small group of citizens, advocates, and bold lawmakers made it their business to put children first.
And healthcare for kids, how can anybody oppose it? When you put it in front of them and don't say it's going to cost $5 trillion, you're going to make that kid able to go to school, that kid able to work, that kid's family able to stop worrying all the time.
They built a movement to pass the most consequential policy to improve the lives of children in 70 years.
We had to break this perception for the lawmakers so that when they met families in their own district that really were trying to access the programs, had done all the right things and still weren't able to get through the door, it began to convince them that there really was an issue, that they needed to get behind it, and that if they got behind it and devoted resources to it, that families would make use of them.
On December 2nd, 1992, the Pennsylvania Children Health Insurance Program was enacted.
Governor Casey was very proud to have Pennsylvania be one of the first states to pass a major children's health insurance program because he knew that that program could transform the lives of not just thousands of children and not just tens of thousands, but hundreds of thousands of children.
Yeah, so I got enrolled in CHIP mid to late 90s. My mother, who throughout my whole life had been employed, lost her job. And because of her losing her job, we lost health care. But, I have bad asthma and have had bad asthma throughout my whole life. So health care was extremely important to me and to my family. At the time, I didn't know it was CHIP. I just knew that I could go to the doctor.
The voice of parents desperate to ensure their kids was powerful, but advocates for children were there to carry the banner.
We advocated, lobbied, we did a lot of publicity. One of the things that we were able to do through the Child Health Watch was to identify families that would verify. So if we were identifying issues to legislators that families were experiencing, we could provide them with a family from their own district that would talk to them about how they had had that experience. And I think that was pretty powerful for folks.
It happened at a time when I think everybody who was working on public health issues in the community and people were really focused on maternal and child health issues had this idea that we weren't going to push things forward unless we raised our voices and started to do things differently.
And I was all about, let's just do it for the kids, and pretty excited about that. So I said, I was gung-ho on this. And so it really felt like just a great moment.
Pennsylvania paved the way for the nation. 4 years after enactment, CHIP became the model for President Clinton and was replicated across the country.
I think we didn't realize how trend-setting it was until we got it done. And then we realized that nobody else had done anything like this. And it was, 4 or 5 years later when the Clinton administration does SCHIP, and it's like, that's our idea. We seeded this. And, all too often in Pennsylvania politics, we were follow behind what other states were doing. This was one where we really led the way. We accomplished something that became a signature program for the rest of the country, and that just made you feel really good.
A lasting impact on the lives of kids created a positive ripple that continues today.
I love signing children up for CHIP because it just gives you that sense of appreciation, something, and you're actually doing something for someone. People really need health insurance for their children, and if I'm able to help them, it just makes you feel great.
People would come up to me, and it could be, a town hall meeting as a state senator. I'm talking to someone, and someone would come up later and say, my husband was unemployed last year, and we struggled around health insurance, and getting CHIP was just a lifesaver.
Knowing that CHIP is out there and available is great. It's giving them other options. Sometimes health insurance on your job may be too costly. So if you know there's another option, it's just giving parents a little bit more of hope.
30 years later, parents can watch their kids enjoy childhood without anxiety about the cost of a doctor's visit.
I feel at ease, at mind, that I know that he's going to be covered and I don't have to worry about anything that I'm not aware of that can come about. Having health care that's going to cover at any time, any moment, any day is very beneficial for me.
Today, nearly 10 million children a year can go to the doctor when they're sick and get the medications that they need to keep them healthy, thanks to CHIP.
I think we all recognized that it was a program that would last for a long time. Quietly we would say to each other, once this gets going, there's no way anybody's going to stop it.
From Fred DeBona on down to young guys like me who were part of this, there was a general sense of we are on to something really special here. We knew the impact that we would have with this program, and we were truly dedicated to the cause.
And as a senator, I've been privileged to have had the opportunity on multiple occasions to vote to reauthorize the CHIP program nationally. I believe that CHIP is one of the 2 or 3 best Pennsylvania programs in my lifetime.
As much as we're worried about where we're going to come out at the end of the pandemic, I think we were much farther along than we would have been, without this access.
It's important to get the message out that we can show how well government can work when it listens to people at home and does the right thing. And that's what gives me more of a sense of reward, even greater now.
Bringing it to people's consciousness. I mean, we put blinders on so that we don't see things that are painful to us. But we got to take the blinders off and say, we can do better than this. And that's what CHIP did.
You can't get things unless you ask for them and unless you're willing to do the work. And of course, that's such a prime mission for PCCY to be able to act in that manner, and it's such a gift of that organization and that organization with all the different partners in the community.
I don't want to be over dramatic, but you never know. Having CHIP could have possibly saved my life as I had to deal with asthma growing up in Philadelphia.
CHIP was just the beginning. From healthcare to education to opportunity, there is so much we can do together. And it can start with a single letter.